Hey everyone, I wanted to talk a little bit today about rapamycin and the effects that it is shown to have on amyloid plaque, which is a precursor for Alzheimer's disease. I wanted to mention this because a lot of times rapamycin is used in the treatment of transplant patients or cancer patients. It's negative impacts in the way that it contributes to amyloid plaque buildup, which contributes to Alzheimer's disease, can obviously speed up the likelihood of developing that neurodegenerative condition. I know that this is not going to be a popular topic that a lot of people are going to want to talk about, but when we talk about the need for transplantation, we should also address whether or not that need for transplantation could have been prevented through lifestyle interventions, through nutritional interventions, to preclude the need for there to be a transplant required in a patient. It requires discipline and it requires sacrifice at a certain level to be willing to forego certain dietary conditions, certain dietary habits, I should say. It requires being willing to be more disciplined in that respect to prevent the need for certain surgical interventions. I guess what I'm trying to say is that if you live a lifestyle that is somewhat, I don't know what else to say other than maybe hedonistic in the way that you consume certain things, and you know, based upon the research, that that is likely to result in you having some sort of negative medical result, you have to ask yourself, what is really important to you? Is it more important to have the temporary enjoyment of eating something that you know is going to contribute to some sort of medical harm in the long term? Is that more important? Or is it more important to have discipline and avoid the likelihood of having to go through some surgical intervention down the road because you refuse to be disciplined in your life choices? I believe that people should have the freedom to decide what they choose to consume. However, I don't think that it is reasonable for other people to be left on the hook financially for their poor lifestyle choices. A good example of that would be somebody who has a drug problem or a drinking problem that contributes to their need for kidney and liver interventions, or in the case of a drug problem, it may result in them requiring all sorts of interventions nutritionally because they have not been taking care of themselves. I realize that there is a distinction between providing care as a medical professional. There's a distinction between that and enabling behavior. So it's a fine line when we're discussing how to address this specific topic. But I'm here to say that when it comes to surgical interventions, once you start cutting on a human body to perform repairs, to replace organs, to do all of those things, once you start doing that, it's a slippery slope, and it's not a permanent fix. And I think a lot of people that go into these interventions are misled in their impressions that it's a fix-all, that it's a way to permanently resolve their poor lifestyle decisions. That's not the case, and if you are believing that, you are putting way too much pressure on your medical professional that is doing their best to help and intervene in a situation that you have made as the patient, one that requires a surgical intervention. It's not always reasonable to blame a healthcare professional who's trying their best under untenable circumstances to help you to get well. It's time to take ownership for your poor choices in life. And it is time to make changes where they need to be made if you really are concerned about your overall longevity, health, and well-being.